Even during a pandemic, babies are still being born. An Abilene midwife says she's seeing an increase in appointments with expecting mothers since this outbreak. KRBC's Catherine Garcia has more.
On March 19th, after going through hours of labor in a large bathtub, Jenna Cox gave birth to her youngest daughter, Stella.
This was my third child.
Although her two older children were born in hospitals, she says she always wanted to give birth naturally. Months into her pregnancy, she discovered Abilene midwife Sabrina Elliott.
The beauty of midwifery is that she is able to switch up her care more than a doctor would be able to, and so she can provide you a one-of-a-kind experience.
This is our prenatal room.
Elliott opened her midwifery known as Crowned back in August. Traffic into her facility had been relatively slow until the outbreak, as patients are under additional safety restrictions in hospitals.
Right now, in the hospital, you can have one support person that has to stay with you the entire time. They can't trade out. And I think that makes people a little bit nervous.
The facility, which is intended to resemble a home setting, offers a mix of traditional midwifery tactics and modern resources found at a typical OBGYN.
But we can take care of a woman who is wanting to become pregnant, one that is pregnant, and then through 6 weeks postpartum.
Although Elliott has recently taken on more appointments, she says she has to be flexible, as many expecting mothers are uncertain which avenue to take, switching back and forth between her services and those of medical doctors. She's even noticed physiological differences in these expecting mothers.
I'm seeing like preterm labor symptoms or and lots of like prodromal labor because women just aren't feeling super settled.
With a close proximity to Hendrick Medical Center, Cox and Elliott say there's always a backup plan, but Cox adds that her experience during and after her daughter's birth has been safe. In Abilene, Catherine Garcia, KRBC, Abilene's local news.
All right, thank you, Catherine. The midwifery is taking additional safety precautions like social distancing and regular temperature checks of expecting mothers and all employees.